Hello, my presentation today it's on COVID-19 and mental health challenges. And my name is Anthony Ozemina. So we're looking at coronavirus disease and the implication on the mental health. Coronavirus, which is known as COVID-19, it's an infectious disease caused by the SARS-CoV-2 virus. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment. And of course, some will become seriously ill and require serious medical attention. It's important to note that COVID-19 was first reported in Wuhan, China in late 2019. Also, the older population with underlying health comorbidities such as diabetes, heart disease, and asthma are more vulnerable to this virus. And looking at the mental health aspect of it, some of the prominent mental health disorders during COVID-19 are anxiety disorder, panic disorder, depression, obsessive compulsive disorder, and insomnia. We'll be looking at the factors associated with mental health problems during COVID-19. We'll look at the age. Um, in respect to age, several studies reported younger age people, are more prone to mental health problems during COVID-19. They mainly suffer from anxiety and depression. In respect to gender, the female gender was reported as a common risk factor for mental health problems in several studies. In one of the studies by Gore and colleagues, female patients with COVID-19 had a higher perceived helplessness compared to male patients. Marital status, they found out that insomnia was related to marital status. Some studies also mentioned, it could be seen at workplace as well. Education. One of the studies found out that mental health among young participants was significantly related to being less educated. Occupation and income. We found out healthcare workers were more likely to have poor sleep quality compared to other occupational groups. Also, lost, economic opportunities due to lockdown were reported in a suicide case of a farmer in India when they looked at the impact, it had on socioeconomic challenges, and that can impact mental health among marginalized individuals. Moreover, people with property loss and adverse economic conditions are also more vulnerable to mental health as well. Place of living and close contact with people with COVID-19. That was one of the studies. They found that was a huge factor as well. The comorbidity, physical health problems. You're looking at people with diabetes, stroke patients, heart disease, and other chronic conditions that were considered a very risk factor. And this can affect or associated with mental health problems during COVID-19 based on several studies. Of course, people that already have mental health problems, we saw a massive increase in respect to that. Exposure to COVID-19 related news and social media. Most people didn't want to listen to, to the news and watch TV. That was a big factor. Also coping style. For example, one of the studies assessed the magnitude and predictors of mental health problems among youth and found out that negative coping styles were significantly associated with adverse mental health outcomes. Psychosocial support. Psychosocial stresses during COVID-19 had low impact on individuals who had better psychological and social support from their family and social networks. And one of the studies found out that individuals with no psychosocial support were highly vulnerable to anxiety and depression during the pandemic. Other factors associated with mental health impacts during COVID-19. There are several factors, with the mental health impact that was reported. For example, one of the studies reported that a high level of confidence in doctors, perceived likelihood of survival, personal protective measures, satisfaction with health communication, and low risk contracting COVID-19 minimized the risk of adverse mental health outcomes during COVID-19. And actually, just making sure you wear your PPE, helped, and was considered a factor, whether you got the disease or not. Presentation of evidence. We looked at three evidence: the general population, we looked at patients with COVID-19, and we also looked at healthcare providers. In respect to general population, we looked at a study that was done using self-rating anxiety scale and self-rating depression scale to examine mental health status among 1,593 respondents that are within 18 years and above in southern part of China. This study shows that the prevalence of anxiety and depression was 8.3% and 14.6% respectively. However, the prevalence was much higher, 12.9% and 22.4% among people who had some type of social network than that had been quarantined, compared to the remaining respondents, 6.7% and 11.9% that had nobody. Patients with COVID-19, a study also conducted shows, to evaluate mental health issues among 76 psychiatric patients and 109 healthy controls from Chongqing in China, using the right instruments for testing post-traumatic stress disorder symptoms, depression, anxiety, and stress, and it came out that the number were astronomically high on the psychiatric patients compared to the healthy controls. Healthcare providers. Some study was performed with, I think, about 2,299 participants. 2,042 were health providers and 257 were administrative staff. It showed significant differences in the severity of fear, anxiety, and depression that were observed between the two groups. The frontline healthcare providers with proximity to COVID-19 patients were 1.4 times more likely to experience fear and nearly twice more likely to experience anxiety and depression compared to the non-clinical staff. So we looked at the recommendation for potential implementation, and we kind of did it in two places: healthcare providers and staff recommendation. We believe that they need to be proactive in taking steps to protect mental well-being of staff. Also, respect the providers or managers, to be frank about the situations staff are likely to face. Staff can be supported by reinforcing teams and providing regular contact to discuss decisions and check on well-being. Also, once the crisis begins to recede, staff must be actively monitored, supported, and where necessary provided with evidence-based treatments. Also, we think telemedicine, consultation, and teleprescribing plans should be practiced, and policymakers should focus on making doctors more aware and comfortable using teleconsultation. In patients' recommendation, we believe providing online psychological support services for those individuals who lost their close relatives due to COVID-19. Reduce media coverage because sometimes it takes a toll. Um, Improve and maintain better social relationship. It's better than patients get together with friends and family. Um, Also, getting fully vaccinated. Benefits and implication of practice. Um, of course, we can benefit when we do what we're supposed to do with the recommendations. We'll definitely have an improved physical health. You know, reduce the challenges we're having with mental health. Reduction in quarantine, helps a lot because since most of us get vaccinated, we have the opportunity of traveling across states, overseas, which actually helps the mental state. The economic growth, the economy start growing again, because the pandemic actually stalled the economy somewhat, which, you know, took a toll on mental health. We have people being anxious, anxiety disorder, depression, but with recommendations, the economy will start growing back up again. Of course, we interact better socially, and of course, psychologically, we improve. And these are my references. Thank you. I hope you enjoyed this. Thank you once again.